Hi, I'm Colin Hung with Healthcare IT Today. As many of you know, one of my passionate topics I love to talk about is patient experience. And I think patient experience has become even more important despite the pandemic. Not only does a good patient experience actually lead to better outcomes, but of course, now it actually impacts bottom lines. And I'm super excited because now we actually have some incentives to encourage good patient experiences to be had across the healthcare ecosystem. Sitting down with me today to talk about improving the patient experience are Lisa Esch, SVP, Chief Innovation Officer for Healthcare Providers at NTT DATA Services, and Dr. Michael Petersen, Chief Clinical Innovation Officer at NTT DATA Services. Welcome to the program.
Hey, Colin.
Hi, Colin. Good to be here.
I am super excited to talk to you about patient experience. It's one of my favorite topics. And I feel that even before the pandemic started, there was a momentum building towards really improving, making vast strides in consumerizing and improving the patient experience. What do you think about that?
I would agree. We have seen a lot of advancement in patient experience, and we see organizations having teams of people focused on it, and they realize that outcomes can be affected and impacted by patient experience. And so it really is a critical goal. It's a lot of times organizations or KPIs are tied to that, and it should be putting the patient front and center. And as we look at how healthcare is moving more outside the four walls of the hospital each day, more and more care happens outside. So that experience is really important when they do engage with you and as they move through the healthcare ecosystem.
Yeah, I'm a huge proponent and advocate for patient experience, having practiced on the front lines, and we believe in patient experience for all, so that everyone has the same access and same experience, no matter their background. And I think, to follow up with what Lisa said, it has to be patient-centric, but it also has to recognize that people have an expectation for a consumer experience because of all the other pieces of their lives. And when health doesn't match that, and it seems fragmented in simple things in terms of my chart or how can I get access about information I need, they will go to the place that does have an experience that's seamless, convenient, and gives them what they need in terms of the questions they're asking. Especially with healthcare, everyone's anxious about these types of moments.
What have you seen, just either from your own clients or just in general, from healthcare providers over the last little while in terms of improving the patient experience? Is there anything that stands out for you, any technologies, any processes?
Yeah, so I think there's been a big push. The big bet right now is all on digital, right? How do we all create this digital experience? But the challenge is that they have systems that don't allow some of these digital experiences. And the way to move forward in digital experience is going to be cloud, right? So how do you get these multiple apps that patients want around that? And just something as simple as scheduling. When you have someone who's trying to go to the operating room and they're pushed back, there's no alert system that lets them know. They just get pushed back, and patients cope with it, and they don't like that experience. So when you think of, Lisa brought it up perfectly, which was if you think of the monetization and the sort of cost value, the value chain around that, imagine pushing back someone's operation that they were, couldn't eat by midnight, and now it's noon and they were supposed to go in it. Those unforeseen experiences are mitigated. I mean, we get alerts on our airplane app when there's a flight delay, well before they even know it, right? So I think the healthcare system is going to try to match that, and there are a lot of digital tools, but someone needs to tie them together because they don't all play together and they're not all stitched in an integrated way to drive that seamless experience.
Yeah, and we're seeing organizations trying to tackle this. They're buying point solutions that are digital, and all of a sudden you have all of these digital solutions across the patient care experience, and they're still not connected. It's still not a seamless, unified experience. And it's not like organizations aren't trying. All you hear about is digital. We need digital, we need digital. They know that the patient, the consumer is demanding that. They know the clinicians want that. If you can get that unified experience for the patient, it impacts care delivery. It can improve that as well. But it takes a way of bringing that all together that isn't a point solution based. Those things contribute to that unified experience. And there's a way to do that that simplifies the whole experience, that drives patient engagement. And also you've got to look at some of the science behind behavior and what drives engagement digitally. Not everybody responds to words and technology in the same way. So you also need to consider, like, how do you humanize that digital experience? And there's psychographic profiles, there's all kinds of things that you can do, and there's research behind that that isn't manipulating the behavior. It's cooperating with how the patient really likes to be communicated with, or it has a way of actually improving the engagement and keeping people engaged, so it drives a better outcome.
I love that. You're talking a little bit about my world of entering some of the marketing technologies and things into the patient experience.
It is, and you know, we're seeing that now. We're doing that right now, and it's great because you don't often think about, we think about it around marketing. And you know, I had a lot of experience with, you know, in my previous life doing that. And I'm like, why aren't we bringing this into this whole digital ecosystem? So that's one of the first things I did here at NTT is, how do we tackle that? How do we humanize that digital experience? So we need to connect it. We need to connect all those point solutions. It needs to be a seamless experience, a unified patient experience, but we've got to humanize it because not everybody responds in the same way. So I get really fired up about that.
Yeah, we call it human by design. And the reason why that is there's an empathy in the design of this person's experience, but it's not just them. When I interact with patients, I'm interacting with the patient and their family. So the experience has to be shared because the family's going to help take care of why they're there. And also the experience has to be proactive, right? And Lisa's getting to that through the cycle. All of our consumer experiences, they know what we want when we want it. Health can get there to a point where it's nudging, where it's supportive, and you get to interact with how you want it to interact with. So yeah, I want to be alerted when I eat a burger, or I don't want to be alerted when I'm not working out enough. So, but people will nudge themselves. Health is a really complicated space behaviorally, and people will talk about adherence, and you got to get people compliant. Those are the wrong words to use. We have to get people to engage with their health and want to do it. And the way you do that is to build something that they'll engage with and consume that helps solve what they want. Because patients have never said, what is the app behind driving this, or what is the technology, and what platform are you using? They don't care. They just say, Doc, I tried to get an appointment, I couldn't do it, or my appointment got canceled, or you're booked through November 23. Those things are important, and patients will pick and choose where they go for their care.
And this is a scary place for healthcare providers because we know the law about marketing, with healthcare and using clinical data. We know that we can't do that. But what we can use are some of the things that we've learned from other industries, which may feel a little manipulative. When you think about the shopping experience and some of those things we do digitally, it can't be that either with healthcare. It truly has to be unique to the patient and with those profiles, with how people engage, and it can help improve the outcome. It can help drive compliance. It can reduce readmission. There's a lot of impact in the outcome that can happen when you humanize it. And when you really take a look at not using the same words or the same method of communication with every patient. Every patient's not the same. Every consumer's not the same.
Just quickly, I'll give you an example of a technology that was implemented that wasn't designed with the person-centered point of view, the EHR. Now everyone likes to beat up on that. And now what are we doing today? It's like we're putting Band-Aids after the fact, or we're trying to stitch on all this technology. The EHR is not the center of the universe. A lot of these experiences are going to be the center of the universe. The EHR is just a mechanism and a tool. But if you think about your experience now, name one moment where you're actually in front of a clinician where they didn't look away to talk to, to type in something, or they forgot what they just asked you because they're too busy doing stuff. Those small details matter, especially when someone's there and they're at the worst moment of their life, or they're for a routine engagement. But Lisa's right. It's going to be that a lot of other digital experiences that are in health are going to be what patients consume, and the patient's going to expect the health system to consume that into their experience.
Let me ask you this. What's one thing that healthcare organizations should start doing right now from a patient experience perspective, and one thing they should stop doing?
How much time do we have? So they have to start thinking about digital literacy, health literacy. You can't design these amazing tools if nobody uses them. And I say that from even some educated people have struggled with some of this health information. So one is they have to keep it simple, and they have to make people like it. So I think of, if you could do Peloton for health, that's amazing. It encourages me to work out, and then I'm competitive with people, so there's a gamification, right? I'm not saying that that's the first thing to do, but they have to make that experience accessible for all, but they also have to make it so that people can comprehend what it is, and don't overcomplicate it, right? Don't say abdomen, don't say things that people don't understand. Put it in a way that they understand it, and they can pick the level they want.
Lisa, over to you. What's the one thing you should start doing, one thing you should stop?
I think we just need a unified portal. We need one place of access and a simple way of doing things. You know, I just recently moved from Colorado to Texas, and I've been in Colorado many decades. And so when I moved, I had to find new clinicians, I had to do all these new things, and I had to go find I had to go to those, like all those portals and try to get my information moved. And then as I found new clinicians in my new community, they're not all part of the same health system. I chose that. So now I have like 7 new portals where I live now. And so it's just this, like, we've just got to have a way and be open to really having things be patient-centric, so I don't have to remember which portal is where, and I know that's about me, but I'm not any different than anybody else. So we all have multiple ways of accessing. It's just complicated. It's just not hard. I don't enjoy it. Nobody does. Nobody just is dying to get on their healthcare portal and like, what's new today? What should I be focused on? Whereas, Peloton, you want to do that. So we do have to figure out a way to. We've stopped making it complicated, and we need to start putting the patient in the center. And we also need to recognize that as every day that goes by, more healthcare happens outside the 4 walls than inside the 4 walls. And how do we make all the care, the new ways of delivering care outside the 4 walls of a traditional healthcare system, make that easy, and it can't get more complicated?
We could talk for hours more on patient experience. I know we could,
yes.
But unfortunately we got to end this conversation. So let me ask this final question. Where can people go to find more information about NTT Data Services? Well,
first of all, you can follow Mike and I on LinkedIn. Connect to us. We would love to have a conversation with you. We both are on Twitter as well. And you can also go to nttdataservices.com and click on the provider healthcare section, and you can reach us that way as well.
Well, awesome. Thank you for joining me on the program today and discussing one of my favorite topics in healthcare patient experience. Really appreciate your time.
All right, thank you.
Thank you, Colin.
Bye-bye.
This has been Colin Hung for Healthcare IT Today. Thanks for watching.